The watery eye. This is one of the conditions that we have all experienced at some point in our lives. And sometimes it's bothersome, sometimes it is not. But it comes with that dreaded question of, why are you crying when you know that it's just this watery eye? So to explore this discussion today, I am going to have a very special guest. And this is the Dr. Tebz show, where we're putting your health back into your hands. My special guest today is Dr. Mpopi Lenake. She is a qualified ophthalmologist who is operating at the Eye Center in Somerset West. She has a special interest in oculoplastics, orbital surgery, and also the lacrimal system. So basically, she treats the eyelids, the sockets, and the drainage system. So she's more than qualified in discussing this condition today. Thank you so much for joining me today, Dr. Lenake.
Thank you for having me, Dr. Tebz.
Yeah, so back to basics. Can you tell me, where do tears come from and how do they drain out of the eye?
Well, the majority of tears are produced in a gland called the lacrimal gland, which sits in the front portion of the eye socket, just above the eye. And every time you blink, the tears are brought onto the surface of the eye, and then they are carried into the drainage system here and into the nose.
Okay.
Basically.
So basically,
yes.
This is where the anatomy
yes.
is. All right. So we know that watery eyes can happen in children and also in adults. So in children, why do kids, babies all the way till teenagers, why do they get tearing eyes?
So some children are born with a blockage in the nasolacrimal duct, which is in the nose, and that's related to a developmental issue. And this usually resolves in about 90% of cases by the age of about 10 months or so.
Okay. And is there anything that parents can actually do to help it resolve, or does it just happen on its own?
Well, because there's a membrane that's in the nasolacrimal duct, what parents can do is gently massage that area, and that helps to pop and that membrane so it opens up.
Oh, okay. So then they can just start this at home if their kids have this problem.
Yes.
Okay. So if this watery eye does not resolve, as you said, after 6 months, what else do you do to help treat it?
So an ophthalmologist can take the child to theater to have a better look to see where the obstruction could possibly be. And also, so we call that procedure a probing and syringing. So we take a small little stainless steel probe and we pass it into the system to check where the obstruction is. So obstruction, blockage. And also what the probe does is that it actually opens up that blocked area. And then afterwards, what we can do as well is put a stent in place, a tube, to keep that open so it doesn't block again.
Oh, okay. So in this procedure, you're not cutting anything?
No cutting.
Okay.
Yeah. So we're looking and we're opening up the membrane.
Okay, so that doesn't sound too invasive or dangerous.
No, not at all, not at all.
Okay, all right. And then in adults though, when they get a tearing eye, why do they develop it? They didn't have a congenital problem. So why do they have it?
So in adults, it could be either an overproduction of tears. So if there's some sort of surface irritation, the eye will produce more tears to try and get rid of that or to soothe itself. Or it can be an actual anatomical blockage somewhere. So the blockage can be either at the opening of the tear ducts, at the area called the puncta, or it can be further along and in the nasolacrimal duct itself. So adults get what we call acquired nasolacrimal duct obstruction.
Okay, and just to clarify, when you say the surface, you mean here on the eye?
Yes, on the eye itself.
Yes.
So say, for example, something flies into your eye and scratches your eye. That'll be very scratchy and uncomfortable, and it'll result in more production of tears. So if you have an allergy or something splashes into your eye, or just a dry eye in general, your eyes will produce more tears to try and relieve the situation.
Okay, all right. So I do see, and I'm sure the parents also the patients at home realize that there's many causes for this.
Yes, there are many causes.
All right. So if, let's say, as you said, it's not on the surface.
Yes.
And so do you also do the same thing in parents, in adults, where, you do syringing and probing, or the other procedures that you do to open up the blockage?
Well, with adults, you do also have to probe, well, not probe as such, but syringe, so you can look and see where the problem is. Luckily, adults are a little bit more cooperative and can tolerate a little bit more manipulation,
yes.
of the tear ducts and that. And so that's something that you can actually check in the rooms. If the obstruction is right at the entrance, the punctum, you can manually dilate it and see if it stays open just after that procedure. If that doesn't work, you can actually make small incisions to widen it. But if the obstruction is more distal, so just in the nasolacrimal duct, unfortunately, the only way to relieve that is to do a tear bypass operation called a DCR, short for dacryocystorhinostomy. Very long word.
Mm-hmm.
And basically, what happens in that procedure is that the tears are bypassed to the top part of the drainage area, so that they drain into the nose via the top part of the system, and not at the bottom where the nasolacrimal duct is.
Okay, all right. So it sounds like there's various procedures.
Yes, there are.
So basically, if I was to describe it for the parents at home or the patients at home, is that to say it's like a pipe, basically, exactly what you're saying. So
Yes.
you've got the stopper there, and you've got the whole pipe.
Yes.
And if the stopper is too thin or small and closed, you either manipulate it and get it bigger, or if it's too tight, you cut it. And then if it's lower down, then you just need to make another passage to get the tears in.
Precisely that. I'm a plumber.
Who knew? You're the plumber in the eye.
Yeah.
Okay, no, this is, and I want to also ask you, so if a patient is suffering from this tearing eye, they've tried everything,
Yes.
drops, everything.
Yes.
Where can they go to get help?
The best place is an ophthalmologist, because we have all the knowledge and the equipment to assess the problem properly and to treat it as well.
Yeah, so basically they can ask their GP, the sisters, to say, please refer me to an eye specialist who can help me with this.
Yes.
And they've got every right to do so.
Of course.
Yes, of course they do.
Yes.
So do you have any closing thoughts on this topic?
Well, I would say that, don't suffer in silence. If you do have a watery eye, there are qualified people that can have a look and treat it for you.
So on that note, thank you so much, Dr. Lenake, for joining me today.
Thank you for having me.
And if you would like to get more information on this topic, please do write in the comments and we will answer you. And if you'd like to contact Dr. Lenake directly, we will put in her contacts in the description. If you would like access to more content such as this, please like, subscribe, and press the notification button so that you will know when we post new episodes. Until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.